Now, you're working on a global initiative to look at drug-resistant TB. Specifically, you've done a lot of work in Vietnam. So what priorities have you identified for Vietnam there?
At this moment in Vietnam, priorities are increased case finding. And that means for Vietnam really going into the pockets, the difficult pockets of society. Migrants, homeless people, people in remote areas, poor urban communities, really reaching out to the ones who are not reached by the standard approaches. That is one. Also moving towards active case finding rather than just relying on passive case finding. That's the first big priority. The other big priority is diagnosis, early diagnosis and initiation of treatment for drug-resistant TB.
Right, you talked about DOT, observing the actual process of treatment. What are you doing there?
Yeah, so the DOT strategy is more than just the DOT part of it, which is directly observed treatment. The idea of the directly observed treatment is that you safeguard that every dose of the essential drugs that are taken is taken in a situation where it's clear that this dose is indeed swallowed. We have moved away from DOT by directly observed observation of the treatment by health worker towards community DOT. So it's like partnering of a community member or a family member in making sure that the patient remembers and takes the drugs in order to be cured, but in the end to make society safe.
And what have you discovered from your work in Vietnam? Because you said you're looking at disadvantaged communities, members of society who might easily get missed by others. So in trying to make sure that they comply with their treatment, what kind of lessons have you learned in Vietnam?
It's important to bring the diagnosis and the treatment, the services, but also the treatment support close to the patients. Physically close, so where they are, but also close to them in a cultural sense. And so at this moment in Vietnam, the civil society organizations are becoming much more involved in service provision, specifically regarding these vulnerable groups, I should say. Sometimes it is they are a specific group because they are more vulnerable than others to the disease and to negative consequences of the disease, and sometimes it's about people who have a high risk because of certain settings where they live, prisons or other high prevalence settings.
You've also got a lot of experience from Central Asia. Yeah. Are there differences there in implementing strategies to combat TB?
Absolutely, absolutely. And that has to do with the very different societies we're talking about. If you would say the comparison, the thing in which they are similar is that structures within society work. We're talking about functional health systems, both in Vietnam and in Central Asia. I mean, Central Asia is a large area to talk about, different countries, but by and large health systems work. Now in Vietnam, TB control has been organized decentralized and with ambulatory treatment, community-based treatment as the norm since years, while in Central Asia, TB treatment, diagnosed treatment has always been hospital-based. So in Vietnam, we are working on, and of course the epidemiological difference in the countries is great.
And which is better?
If proper implemented, community-based is easier for patients, and therefore encourages, makes it easier for patients to adhere to these very difficult treatments.
Right, now, if you were just to give a take-home message for doctors in 10 seconds or so, what would that be from your studies and your discoveries in Central Asia and Vietnam? What should doctors take home and other healthcare professionals?
Think of TB. Because in the life of clinicians, most doctors, they only, TB is not their major problem. Their problems are maybe high blood pressure or the common infectious diseases, TB is sometimes not in the forefront of the mind. So think of TB is the first one, and if you think of TB, act with appropriate diagnostics, a rapid diagnosis of TB and drug-resistant TB, and then a patient-centered approach towards treating.
Thank you very much.
Yeah.